Welcome back to The Full View. Now, South Africa is one of the largest HIV-positive populations in the world, and many experts have been concerned that this segment of the population could be even harder hit by the COVID-19 pandemic. But an expert from Netcare Group says properly managed HIV patients are probably at no greater risk from COVID-19 than the rest of the population. We're joined now by HIV clinician Dr. Kairoonisha Mohamed from the Netcare Garden City Hospital in Johannesburg. Doctor, thank you for being with us. This is great news because there has been a huge concern about that HIV-positive population. Tell us more.
I must say I have lots of patients who've been very worried, and not just for themselves, but also the employers have been wanting to know about their status. And I've had to reassure all of them to say, if your viral load is undetectable, your CD4s are fine, you shouldn't worry about a thing. You chaps have done the right thing. You've taken your meds, you've taken them properly, and you will now reap the benefits of that. You're as good as anyone who's HIV negative because your viral loads are fine, they're undetectable, the CD4s are high, and do not panic about anything more than that. Remember, all you need to worry about now is what every other person worries about, like a face mask, washing their hands properly, and more than that, don't increase your stress levels. You're doing really, really very fine. The patients who we worried about are the patients who have never been on treatment or the patients who have defaulted treatment. These are the patients that are very, very, very worrying to us.
And we'll talk about them. May I ask, how sure are you that this population is likely, you say, at no greater risk from COVID-19? We know the science around COVID-19, only a few months old, still lots that we don't know.
I must say we still don't know too much about what is happening with COVID and HIV. We have a burden population here that is different from everywhere else. The rest of the world doesn't have the same numbers that we do in this country. But remember, a while back, we started with the test and treat program in this country. So we didn't wait for patients' immune systems to crash before we put them onto treatment. We started putting them on treatment as soon as they tested. So their immune systems are doing fine. They're taking their meds. And these days, the meds are just so wonderful. They have no side effects. They have no toxicities. They allow the virus to be zapped quite quickly. It allows the immune system to reconstitute quickly. So the drugs we're using as well have just, been an extra bonus to patients with HIV. So I seriously don't think our patients who are have undetectable viral loads and good CD4s are going to be in any danger whatsoever. But like I say, our burden here is different from elsewhere in the world, and time will tell.
Well, I sincerely hope that you are right, but you raised that concern that people aren't taking their medication or haven't even started. And we know that some clinics and hospitals are focusing on COVID-19. Is there a concern that HIV patients could fall through the cracks or find it a bit harder to get their medicines?
I think the lockdown has also been very, very, very worrying, because a lot of patients have not been able to access the ARVs, and you can imagine how this will put us 10 steps backwards. The patients that have not been able to access ARVs because of the lockdown is very, very worrisome, aside from the group of patients who have not accessed ARVs or defaulted from previously. But now with the lockdown, lots of patients have defaulted. And what's really worrying on multiple levels, we have pregnant mums who, the babies are at risk if they default. We have breastfeeding mums who, if they default, their babies are at risk. We have discordant couples who we know U equals U, where undetectable equals untransmittable. So all these patients who've had undetectable viral loads with negative partners, those partners at risk. And also then our own patients who default treatment can be at major risk, not just because of COVID and because of the opportunistic infections that come with it, but also because now it'll change the dynamic. These were patients who've done well to date, And now they haven't been taking their treatment, so their viral loads will climb, and then we're going to have to monitor them more intensely, put them back onto their same treatment, and hope to God that they haven't developed resistance to the treatment, because if they have, then the easy regimen of taking one tablet once a day will now change. So it is a bit worrying. It is really worrying, even like I say, with the lockdown, for patients who haven't been able to access care.
Sure. Well, may I ask, do you think it's getting better as the economy opens up? Is there a real appreciation amongst the health fraternity that if COVID-19 becomes the only priority, a lot of these other things can fall by the wayside, but with huge consequences down the line?
We're just hoping that everyone now accesses their ARVs and gets that on track, and then we don't have to worry about the ARV bit. We can now focus on the COVID bits.
Dr. TB is a condition associated with HIV, also a large population there with both. Are you more concerned about how TB patients will fare if they contract COVID-19?
I must say the HIV is not a concern for me right now. The biggest concern for me right now is the TB that comes along also at this time of the year. Our numbers in a strange way seem to spike in winter as well. So these patients will have like a dual hit. They'll be hit with not just the TB, but also with COVID. And remember, the mode of spread seems to be about the same in both of them. It is airborne. So very worried for our TB patients, I must admit, because generally the TB are generally the immunocompromised patients. So very, very worried, not as much with the HIV, but more with the TB and the COVID as well.
All right, we have to leave it there. Thank you very much. That was HIV clinician Dr. Kairoonisha Mohamed from the Netcare Garden City Hospital in Johannesburg. So some heartening news. She says that there's no reason why HIV-positive patients won't fare just as well as healthy patients if they take their meds. That's the main takeaway. We take a short